Ladies and gentlemen, welcome to sqadia.com. My name is Mohammed Osama, and today we are going to talk about the anterior and the medial compartment of thigh. In this lecture, we're going to cover the section including the surface anatomy and bony landmarks of the anterior and medial compartment of the thigh. We're also going to talk about the muscles of the anterior thigh, in which we're going to talk about the different muscles, and then we're also going to talk about the quadriceps femoris group of muscle in the anterior thigh. We're also going to talk about the muscles of the medial thigh, or the muscles of the medial aspect of the thigh, and at the end we're going to talk about the adductor hiatus and the adductor canal. So starting off with the surface anatomy and bony landmarks, we're going to take a look at the bones which are actually present underneath the anterior and the medial aspect of the thigh, including the innominate bones, which consist of ilium, ischium, and pubis, as well as the femur. We're also going to talk about the specific and special biomechanical Q angle in this region, and we're also going to talk about the surface anatomy of the anterior and the medial compartment of the thigh. Moving on, we are going to talk about the muscles of the anterior thigh, in which we can talk about the iliacus and psoas, which are known as the collectively iliopsoas, and we're also going to talk about the tensor fascia lata, which actually inserts via the iliotibial band, and we're also going to talk about the sartorius muscle. One another group of muscle which is present in the anterior group of muscles of the thigh are actually the quadriceps femoris, which is actually a combination of 4 different types of muscles. Quadriceps femoris, consisting of rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. Moving on, then we're going to talk about the muscle on the medial aspect of the thigh, in which we're going to talk about the sartorius, pectineus, gracilis, adductor muscles, and as well as the obturator externus. In the adductor canal, we are going to talk about the adductor hiatus and how the adductor canal is formed, especially talking about the structure of the adductor canal and contents of the adductor canal. So that's pretty much the contents of this lecture, and stay tuned to sqadia.com, and we'll talk in more detail in the upcoming sections. Thank you very much.